Okay.
Good morning, and thanks for coming to the May 12th Board of Health meeting. It's 9 a.m. and I'd like to bring the meeting to order, and Barbara is going to read the governor's paragraph.
Maybe we'll be through with this soon. Right. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the opening meeting law and the governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Southborough's website at southboroughtown.com. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner: by finding the meeting at southboroughtown.com remote meetings. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time. Ours will be recorded via technological means. In the event that we are unable to do so, despite best efforts, we will post on Southborough's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting.
Thank you, Barbara.
Yeah.
First of all, I'd like to welcome our new board member, Chelsea Malinowski. Hi, Chelsea.
Good morning.
Hi, welcome. Congratulations.
Thank you.
Welcome.
Do you want to say anything to the board?
Sure. So I'm very excited to be here and to join this board. And I'm looking forward to working with you on getting through this budget season and getting a long-term plan in place for Southborough. As some of you may know, I also sit on the as a selectman as well. And I previously was on advisory. So I have more of a financial background, but I also have worked for hospital finance systems. So familiar with some of the terminology that you all use.
Thanks and welcome.
Thank you.
Thank you.
So we had talked about the really the primary reason for today's meeting was to present our really what we've been up to over the past year, to inform the residents what's been going on with the pandemic, and then discussing our budget going forward in 2022. As everybody knows, it's really the weight of a lot of COVID has been on the Board of Health and some of the challenges that we've had because of our underfunded and understaffed department. So we're going to talk about that. I think first I would like to, as all of you know, we were awarded the Shared Services Grant, which is really exciting. I'm not sure how much Southborough is going to benefit, but we're going to work really hard with the group to make sure that it's equitable across the four towns, Westborough, Northborough, Southborough, and Boylston. It'll be for help with nursing services and inspectional services. And then we'll obtain this expensive software for food and housing code, which is really getting us updated and our ability to manage all of the data that comes in from those inspections in a digital format, which is in a direction that we want to go. So that's kind of exciting. I'd like to make a motion to vote on a representative that will represent us in the Shared Services Grant. They are asking for each town to have one representative that will vote on behalf of the town, and then an alternate in case that primary person can't vote. Whenever this advisory group comes together to make decisions about the Shared Services Grant, each town will have one vote, and that person will be the voting member. So does anybody second that?
I second the motion.
Any discussion about that? Any questions?
Can I ask a few questions, Mary Lou?
Sure.
So do you know what the other towns are doing for their representation?
The requirement is either a board member or a Board of Health staff member. That's
Okay.
the requirement of who they are to represent. And 3 of the towns voiced that their health agent was going, or 2 of the towns expressed that their health agent was going to be the point person, and the other town hadn't decided yet. So I
Okay.
don't really know. I think it makes a lot of sense that Heather is going to be, knee deep in all of this work on a regular basis. And so I think it makes sense that Heather's our primary, and then we need a secondary, an alternate.
So
Okay.
are any of us allowed to attend those meetings?
All of them.
And then maybe we would talk about what our position is in these meetings to then bring it back, and then Heather can bring it back to the advisory group.
Yeah,
Is that
absolutely.
kind of the setup?
But,
Yeah.
but only one of us can go, right? Because otherwise we'd have to post it as a meeting.
Well, I think at this point, it's all going to be online. It's going to be Zoom meetings right now. I mean, when it comes to in person, that might be different, but you're right, Nancy, only one of the board members could be part of it, but we could communicate who wants to be on it, or it might make sense that one of the board members is the alternate, because the primary and the alternate can be on all of the meetings. And so I don't know if one of you want to be the alternate going forward.
I'm happy to do it if
All right.
you
Okay.
aren't, if I'm happy to. I don't know. Maybe I can talk to Heather offline about what the time commitment is and when they are.
So during the setting up phase, which is May and June, right now, we're tentatively going Mondays at 1 o'clock for an hour.
Okay, that's fine.
Yeah, that would be great because I often work on Mondays and wouldn't be able to attend.
Okay. Mary Lou,
All right, that's great. That's awesome. And then obviously, I mean, I'm working right now. There's a subgroup that's working on the scope for nursing, and I'm working on that. That's really my expertise, and so I'll work on that subgroup, but obviously come back to both of you with that information.
That's great.
and is that related to the shared service
It is.
grant piece? Oh, okay.
Completely.
So
Okay.
the advisory, right? So the advisory is going to help with the management and the oversight and making decisions. And right now it's nursing services and it's inspectional services. So at this point, at the last meeting, they asked a subgroup to come together to develop the scope of work for nurses and what they'll be expected to do. And then they plan on bidding it out to probably a V&A, something like that. And so the nurses won't be employed by the town of Northborough, but they will be contracted with the town of Northborough. So
Right.
whether that's going to be 3 part-time people or 1 full-time and 1 half-time, it's 1.5 time nurses, 1.5 nursing services. So that subgroup is going to come up with the scope and then come back to the advisory with it.
Got it. Okay, that makes sense.
And I agree, Mary Lou, you're great for that role.
Yeah, I'm happy to do that. Thanks.
Thank you.
So I'd like to take a vote to appoint Dr. Heather Alcar as our primary voting member of the Advisory of Shared Services Grant.
Second.
And Chelsea, how do you vote?
Aye. Well, you need a second, right? So
I
I
need-
seconded.
Yeah, I need a second.
All right, second, aye.
And
Nancy?
I vote aye as well.
And Mary Lou, I vote aye as well. Thanks, that's great. And now I'd like to make a vote to appoint Chelsea Malinowski as our alternate board member on the advisory.
I vote aye.
You guys second?
You get a second.
Go second, and then I vote aye to have Chelsea as the alternate.
And Chelsea?
Aye.
And Mary Lou, aye. Great. That was painless. So now I want to talk about our budget. So the last budget that we approved by the board was for $234,281. It was for keeping keeping the public health director position as 19 hours, which was our 21, but at the new rate, keeping our nurse at 15 hours at the new rate. And both of those positions would be supported by CARES Act and reserve fund if needed, so that they would be full-time through June 30th of 22. The one piece that we've really struggled with is Barbara's position, the business associate position, to be shared as it currently is 24 hours with Board of Health and 16 hours with Assessor's Office. And right now, the advisory and Board of Selectmen do not support us to have that position full-time at 54,000 on our budget. So as all of you know, there's been a lot of discussion. I've spent countless hours trying to navigate all of this. And I guess I want to make a motion to revisit our budget and take a final vote.
I second the motion.
So I guess the discussion that I'd like to have is really related to, well, let me go to the easy one first. So we had $10,000 in our budget for a new printer, scanner, copier, or multiple, whatever we need to get us HIPAA compliant and give us the ability to digitize our records. And the advisory, and I guess supported by select board, was to move that 10,000 out of our budget into town budget. It actually got voted to move it to reserve fund, 10,000 into reserve fund to pay for whatever technology means we need once we visit with our new IT person and our plans to hire a privacy HIPAA and consultant. And so between that privacy security consultant and our new IT person, they can help us decide what equipment we need. And we've been assured that we will be able to get whatever we need to bring us into compliance. So that is out of our budget. So does anybody have any questions, concerns about that?
I do not.
I'm good with that.
Okay, so the only outstanding thing we have right now is really whether Barbara's position is split or it's fully in our budget. And in the late night discussions last night, I spoke with Kathy Cook, and I believe she's on, and she said she's happy to come on. She's given us assurance that they will support our budget completely as we submitted if we continue to split Barbara and take advantage of CARES Act funds for those 16 hours, and assured us that Barbara will work in the Board of Health office for her full time so that we can have the health office open 5 days a week, as we have expressed that we need to do that. So is there any discussion on that before I bring it to a vote?
No, I actually think it's a really good idea. And it seemed to me in these past few meetings that Barbara didn't feel really comfortable with not splitting her position. I think she had a lot of worries about that, and that didn't set well with me because it's important that she feels comfortable in her, work status. So I think it's a good idea. I think it's a good resolution to our problem, and it's always, we want to go in having advisory backing us. So I think that's going to be helpful.
Okay. Chelsea?
I agree with that as well. And I think, over the past year, it seems like it's worked out okay. And I think with Barbara getting an updated laptop, she'll be able to be more flexible. And
Yeah.
so I'm in full support of that. I just want to make sure that before we leave this meeting that we articulate, and I know Kathy's in the audience, that we articulate clearly what the number is. So that way, when advisory and selectmen meet next week, we have the number that we vote on today there. So that way we don't have to scramble next week.
Yeah, and I updated the PowerPoint Chelsea, so I'm
Okay.
gonna talk with that. And so as we go through it, if there's any numbers that don't make sense, we'll fix it right then and there.
Okay,
So we have it.
perfect.
So I think that
Okay.
will help when we can visually see the numbers in the table
Yeah.
going forward.
Okay.
I
Kathy,
just want to see if Kathy had any,
She is.
okay. Can you bring her over?
she has to unmute. Here we go.
Good morning, Kathy.
Good morning.
I don't know if you've heard our discussion or if you wanted to add any thoughts before we take a vote.
I I have heard it, and I don't see me. Do you guys see me?
We cannot see you.
No,
But I hear you.
Should be there. Well,
Now you're muted.
Okay, there I am.
There you are.
Yeah, okay. All right, I just wanted to get in because I've done the numbers too, Mary Lou. And I want to compare notes with you, and make sure we leave here with the number so that we know what the amendment has to be at town meeting, because there's going to be 3 amendments at town meeting that relate to this. The reserve fund is going to be amended to increase it by, remember, we can, as long as the net number goes down, we can do this. So if reserve fund goes up by 10, assessor's budget is going to have to go up a little bit because they don't have Barbara's salary in, correct. They still got her in as, so that's got to be fixed. This is a little bit change, but it's still a change. And one thing I wanted to point out too, I just took a look at the SAP step 5 numbers, and the beginning number is 54,230. They probably, after you did this, voted to increase the bands, the high and the low that they need to do because of inflation. So the band is 54,230 for the starting point for step 5. So I think we got to use 54,230
Okay.
plus the 600 to get to the right number for Barbara. These are all
Okay.
small numbers, but we got to get it right.
Okay. So
Carla, just so you know, Carla McCullough, I think, is in the audience too. I can't tell who's in the audience, but I think she's there too. So
Yes.
I guess that she'll raise her hand if she hears us say something wrong. So
okay.
I think she's there, and I think Brian's there too, listen to us. So hopefully we leave here with the number we agree on, so then we know what the amendment is. And then we should, since you're talking about how to do town meeting, we should talk about, so there's 3 numbers to be amended. I would say we want one person to hold the budget. That's how you do it. They start reading the budget numbers, and then you say hold if you want that budget set aside, and then you vote on everything else, and then you go back to the held budgets. So I think one person should do the hold to make sure we get them held right and they don't hear competing voices there. Doesn't matter who it is, but we should pick that person for that Saturday who's going to go hold. And then we'll decide who's going to explain as far as what the proposed changes are. And I would also propose, you don't want to get into a long-winded explanation of the fact that we're a little concerned about HIPAA. You just want to say that we're just, this is what we're doing to make sure that we are in compliance, period, in all departments, not just Board of Health. So we kind of keep that brief to not throw something out there in the public that shouldn't be out there. Okay, so I'm gonna stop talking, but I sent the spreadsheet 15 minutes ago to Mary Lou, to Chelsea, to Brian, and to Carla. So they've got it. So we just need to make sure we agree with the number and make sure that we're doing it the way Carla wants it done as far as the computation, because it's a little tricky. She uses 52.2 weeks, not 52 for fiscal year 22. So I just want to make sure we get the right number for Carla so she agrees with it so that we don't have to go back and talk about this.
And do you mind reading the numbers you have? Because I
Yeah.
calculated everything off of 54,000 plus the longevity. I split 24. It's 600 for longevity. So I split that with 2436. So it's 360 and 240 for assessors.
So now, Mary Lee, I'm going to change the 54 right now to 54,230.
Okay.
Okay, so let me do that. So Barbara, you're doing good this morning. Okay, so I've got, when I do that, I get 32,898 for what belongs in the BOH budget. So that means the rest of it goes in assessors. So I
Right.
took 54,230 plus 600, then I divided by 40 hours and multiplied times 24.
Okay.
Okay, so 32,898 for Barbara's salary in the BOH budget.
Can we make sure that Carla's in agreement so we don't have any controversy of later? Is Carla in agreement to that number?
She's coming in.
Carla, you're muted.
Okay. Hi.
Hi.
Good morning.
Good morning.
Yes, the number of weeks we want to use is the 52.2, actually.
Okay.
That's what we
And
want to use.
That shouldn't matter for this one. It does matter for Heather. And it does matter for Heather. And it probably matters for the nurse, but it shouldn't matter for this color. All we're trying to do is split the total between the two departments. So we know what the total is. The total is 54,230 plus.
54,230. Yep.
Yeah.
Plus the 600. Yeah.
All I did is divide by 40 weeks times 24. So we're just trying to get the ratio right there.
Okay.
The rest of
Yep.
it will go in the assessor's budget.
Okay.
Okay. You're okay with that?
Yes. Yeah, I am.
Okay. All right.
So-
So Mary Lou, let's look at health director and see if we agree on that number. So that one,
Kathy, hang on one sec. So the 32,898, is that with longevity in or no?
yes.
That's with it in. And
Yes.
so do you agree that the longevity is 360 for Board of Health and 240 for assessor?
If 360 is 24 divided by 40, so that's what, 3/8 times 600.
Yeah, I agree with that.
Chelsea, you said yes?
Yes, just do 0.6 times 600 and you get 360.
Okay.
Yeah.
All right, we agree.
Okay, so that brings our personnel line to, let me make sure we have that. So it's 32,898 plus, oh, let's agree on Heather first before we add that up.
I
You're
agree.
right.
Okay, so let me tell you what I did, and I think I've got your number, but I may have taken it out further than you did as far as digits go. So when I did the computation of the hourly, I ended up with $66.10577.
Correct.
Okay, so I used that, right? And all I did was multiply that times 19 hours a week.
Yep.
Okay, and I get 65,564.
Okay, the rate that I got, oh, sorry, am I on mute? No, okay.
Nope.
The rate that I got, taking the 110, dividing it by the hours, 1671, which is like 32 hours times 52.2, I got 65.83.
Okay, so what did you do again, Carly? Exactly?
So I took the 110.
Yep.
And then I took the 32 times 52.2,
Okay.
right?
So I don't think we did the 52.2. I think we did 52. Okay, so Mary Lou, she's using 52.2 throughout the town. So we need to be
Yeah.
consistent. Okay, so Carla,
Yeah.
what's your hourly again? 65 what?
65.83.
Okay, so can we agree on 65.83, Mary Lou?
Yep, that's great. Okay. And so now we take 6583 times 19. Right?
Yep.
And what's the annual you get, Carla?
So 65.83 times 19 times 52.2, because this is what we're creating the budget for, Heather.
Yep.
I get 65,290.19.
Okay, that's what I get to. So let's just put 65,290 in there. We're rounding to the nearest dollar, right?
Yep.
Yep.
So 65,290 in Heather. So there you go, Heather. All right, let's talk about.
And then the nurse, Taylor, because I didn't do the 52.2, so we might need to relook at those numbers.
Okay, Carla, what do you have for Taylor?
I got 33,880.41. That's
That's what I
Taylor
got too.
at 15 hours a week.
That's what I've
For
got too. So let's use
2.2.
33,880, round down to the nearest dollar again.
Yep.
Okay, so Mary Lou, that should mean your salary line is $132,068.
Got it.
Okay, all right, we're doing good here. Then, now I got to correct, the reason I was trying to jump in, I got to correct something. I'm only one member of advisory. So we haven't voted. We're going to vote on the 19th for this revised budget. I believe we will support this because you've done what we've asked you to do, which is split the admin. So I have no reason today to believe that it's not going to be totally supported with a unanimous vote. but I'm still only one. We still have to vote. BOS has to vote too. But again, this is what we wanted you to do. So we should leave here confident that that is what's going to happen. Chelsea sits in 2 seats, so she will say something right now if she disagrees with me.
And we're meeting on Tuesday. Board of Selectmen.
This coming Tuesday.
Yes.
Okay, so, and we're meeting on Wednesday. So you guys will vote on Tuesday, the 18th, we'll vote on Tuesday or Wednesday, the 19th. So we should be done. Okay, so Mary Lou, let's just go over the rest of the numbers I've just left alone. But let's make sure we agree. Office equipment, I've got 0.
Not a problem. Stacy.
Yes, and I just want to put out there that my only concern is if for some reason it's not voted to amend the reserve fund to add the 10,000, then we'll have to keep it in here.
Well, you just have to, we'll have to see how it goes, right? So then you'll vote to do another amendment to your budget to up at 10,000 if the reserve fund doesn't get increased by 10.
So reserve fund vote, will that be after the Board of Health vote?
Reserve fund has a lower number, so we probably get to reserve fund first if they do
Okay.
them in numbers. So reverse fund comes first. Then I forget what the number of the assessor's budget is. Carla, do you know?
Reserve fund,
No,
180.
reserve fund's like 180. So in this one's
Yeah.
512. So we'll do reserve fund first for sure. I
Oh,
don't.
the department, you mean? 132? I think it's up towards the
Right. So you probably
135, yeah.
probably talk, but we got to talk about it all in one. So we won't vote one at a time. We'll talk about all 3 together.
Oh,
So
okay.
it's really one vote. So there's no reason to vote
Okay.
yes on BOF and then vote no on reserve fund. So we'll talk about the whole thing in one conversation and then just ask for the amendments to be voted on in one vote. There's no reason to vote on one at a time.
Okay.
Okay.
Just to add a wrinkle to the 10,000, I don't think the state will approve the printer as CARES, but I did ask the question. They're going back to their compliance team now. Like I heard a lot about this $10,000 printer, and I said, you know what? No one ever asked me if it was CARES, so I'm gonna just ask. And
Great.
you know, who knows? You know, so if I hear something, I told Heather I'm keeping her in the loop with a couple questions that the board had. So, you know, hey, can't win if you don't play.
I want to just stress, we need a printer and faxing capabilities. I mean, Barbara yesterday takes it up to assessor's office. I don't know. It just seems unacceptable not to have.
Yep.
printing and
Yep.
faxing.
Well,
Heather, there's
we'll
lots
see
of
what they
ways
come
to
back
get
with.
printers. You can get small, really powerful printer scanners these days. So just Jason is on this. I promise you. I've had a long conversation with him. It's at the top of his list. So we'll get it resolved very quickly. But if it's in reserve fund, it's not really budgeted. So that's great, Carla.
We'll see, you know, here's hoping.
Okay, so Mary Lou, again, office equipment, I've got 0. Employee training, I've got 2,000. Advertising, I've got 300. Wireless phones, we know got moved to budget 159, so that's 0 in your budget. Print mail communications, 500. Contracted services, which is the inspector, is 64,224. Other office supplies, 800. In-state travel, 2,000. Dues, 800.
So we're on the same page. And
I've got a total of 202,692.
92. Yep, that's what I got.
Okay, so if that is the final number, the amendment will be 31,589 to take it down from 234,281 to 202,692.
Correct.
Mhm.
Okay.
And I just wanted to note, Carla, you can confirm this, that 64,000 for inspectional services, 224. This past year, we were, what was it, 52? We were expect to bring in 59,000.
Yes.
So
Yep.
to Kathy, that in your discussions, or even Chelsea and Board of Selectmen, I mean, it's bringing this up is almost a net zero to the town. It's just allowing us the ability to get the inspections done when they need to get done. So I think
We're
that-
all for increasing revenue, Mary Lou. And so anytime we can increase revenue, go for it. So we want other non-tax revenue to be increased. So it takes some of the burden off the tax levy. So that's great to try to increase that. In fact, this year, one of the things that advisory and board of selectmen did was look at all fees to see if we were where we should be with all the fees we charge for all the various things you have to pay a fee for. So we want the fee revenue to be fair market value. So that's great.
But I know in your past discussions, like there was a lot of debate on whether we needed to go from 52 to 64. And I just want to make note that, you know, even this year, we made money on that. And next year, we don't know, but we need to increase to 64 so that we can get those inspections done, which is going to bring in more money. So I just wanted you to know that for your meetings.
See, the problem was you didn't make it clear that increasing that would increase revenue. So in other words, if you're saying there's a direct line between what we spend on that and what we collect, that's a statement. But if you're saying, no, we're going to collect what we're going to collect, regardless of whether Dennis works Wednesday, Thursday, Friday, or someone else works Monday, Tuesday. But what you're saying now is, no, if we can increase that, we can increase the revenue. And so we want to increase revenue. So that's good.
Right.
Okay.
Right. It's all proportional, an inspection only happens if it needs to happen and a fee comes in for that inspection. So it's a direct correlation.
All right. Okay, so I'm going to get out of the meeting. I think we're all set. Advisory votes on Wednesday, board assignment votes on Tuesday. And I'm confident that you will get the vote you want. I'm very confident, so I would be willing to bet on it. Anyway, then we just need to make clear, so we try to make it smooth at town meeting, who holds the budgets and then who basically speaks to the amendments we're asking for the 3 departments. Okay, so we'll talk about that later.
Okay, thank you.
Okay, Carla, does that sound right to you? Everything okay?
Yep. Yep. If you want to send me your spreadsheet, Kathy, that'd be great,
I will.
actually.
And I assume Brian would have raised his hand if he had a problem, and he has not raised his hand, so.
Yeah.
Okay, all right, so thank you guys, seriously, and onwards and upwards.
Onwards and upwards. Thank you. Thank you, everybody.
Chelsea,
for-
congratulations
Yay.
on your win. All
Thank you.
right, okay, bye-bye.
Thank you. Bye.
Bye-bye.
Okay, all right, so now I'd like to make a motion to, well, actually, I already made a motion to revisit the budget. So I'd like to take a vote on this budget. If anybody needs me to revisit the numbers, I'm happy to. I'm not gonna need to update the spreadsheet on the PowerPoint because it's not accurate right now, but I'd like to make a vote to approve this budget we just discussed, 202,692 as our final budget for Board of Health for 2022.
I second the motion and I vote yes to approve the final budget at 202,692.
Chelsea?
Mary Lou, can we just add to your motion the breakout between salaries and operating expenses so that, because in the warrant, it's printed as the 2 line items. So just
Okay.
to be clear on those 2, because
Sure.
well, in our amendment, I think we need to do that on town floor. Town meeting.
Okay, so I'd like to take a vote to approve the revised Board of Health personnel budget to 132,068.
I second the motion and approve the 132,068 budget.
Chelsea?
Aye.
And this is Mary Lou and I vote yes. And so now we'll look at the operating expenses. Our operating expenses is at 70,624, which is a reduction of 10,000, which is the printer. I'd like to vote to approve that as our revised budget.
Second.
I vote aye to approve the operating expenses budget at 70,624. This is Nancy Sacco.
And Chelsea
Chelsea, aye.
and Mary Lou, aye. So that gives our total budget of 202,692.
Mhm.
Second. Oh, did you
Third.
want
Yeah.
sorry, were you making a motion?
Yeah, I was making a motion to approve
Okay.
the total budget of 202,692, which I think we already did, but we can do it again.
Okay, second.
Third,
You vote, how do you vote, Nancy?
aye to approve are we doing the total or are we
Yeah.
still splitting it up? Okay,
This is
the
We-
total budget
We did all,
at 202,692.
Aye.
and Mary
Chelsea.
Lou, aye. Yeah, and so just so we, there's no questions, our personnel is 132,068, we just voted on. Our operating expenses 70,624, and our total budget 202,692.
Yeah.
Thank you, everybody. it's hard without it on the screen, I know. And if we could shift to the presentation, that would be great. So I think I need to share. Can you guys see?
Yes.
That's great. Okay, so we're gonna have to, this has the old numbers in it, so I'm gonna have to update this before it gets posted, but at least we can get through the discussion. And the primary purpose of this is for residents who haven't really been following a lot of our meetings, to get a better understanding of why we have an increase in our budget. So and talk a little bit about what we've done and what our plans are into FY22 and the future. So we're just going to touch briefly on these issues, current issues, and why we need your help, how we got here, what we do and how we're doing currently, and our proposed budget and plans for 2022. So really just to give everybody some background on the current issues, the Board of Health staffing and budget has not evolved, or has evolved as the environmental changes have grown. There's been increased requirements on the Board of Health. There's new regulations that require increased attention, yet our understaffed and under budgeted department has been a longstanding problem. And as each of these requirements have increased, they've been small, incremental increases over time. And they really were exacerbated by the pandemic. They weren't caused by the pandemic. And so because all these little incremental increases that we've had over the years, now all of a sudden I sort of equate it to where, we're rowing up a river with one paddle. And now all of a sudden we have reached a rapid and our paddle broke. And so we're just trying to manage. So through the course of the pandemic, we've worked really hard to meet the demands, but we've done it through unsustainable short-term fixes. And I'm going to explain what some of those are. We've hired temporary staff using CARES Fund money, which is great, but that money runs out in December. We replaced our long-term part-time health agent with an interim health director whose skills and qualifications match the needs that we currently have, more of a public health background than an inspectional health agent background. We hired and lost a public health nurse through the pandemic because the demands were so great. Happily, that we were able to rehire a new public health nurse, Taylor West, who's with us now, who just recently came on board. We've had to reprioritize a lot of the important work that we deal with in order to deal with their pandemic. So some of our requirements and our statutes have fallen behind in what we've been able to do to make sure we're able to meet the demands of the pandemic. We've worked with several neighboring towns. I have to say, Dr. Heather Alker has just really jumped in, and she's just came on board in January, and she was able to work with other towns to set up a COVID-specific clinic, vaccine clinic, and that's been going great. But that requires a lot of time and energy of our director, our nurse, and our temporary staff. We've also joined with other towns in applying for grants. The shared services grant, which we just talked about briefly, we were awarded this past week. And that's going to help alleviate some of the strain on our staff to supplement some of the work that we need to get done. Some of our financial concerns and our thoughts for the future is that our current Board of Health budget, which we just discussed and we'll discuss more, is an increase, a significant increase from FY21. However, even with that increase, it's short-term fixes. By utilizing CARES Fund to get us through this year, the Board of Health still has concerns, and I'll leave some room for the two of you to speak if you want to, but our discussions have been that our concerns in doing this is that come FY23, in order for us to maintain our full staff, our full-time health director, full-time nurse, and full-time business admin, is going to rely on the town funding to do that, unless we can come up with some miracle other solution. And our long-term funding uncertainty puts the Board of Health's ability to meet the statutory and regulatory requirements at risk. So until we can find a sustainable funding source to maintain this core staff, we're going to continue to be challenged to meet the needs. This is the budget that I need to redo this, and I will send that out to everybody, but I can't fix it right on the screen, or I would, because this is an input. This needs to get revised as well, which I will do. But this shows, with the new numbers, our public health director will be funded part-time through our budget, part through CARES Act, and the reserve fund is really a backstop if CARES Act doesn't cover the balance. The same with the public health nurse, and the admin, which we just discussed, will be fully budgeted through the town budget and CARES Act. I just wanted to note too that the blueprint of public health excellence, which the state published in 2019, that blueprint really gives us the roadmap for bringing our health department into compliance. And the things that we need to be in compliance is a public health director, a public health nurse, a health agent, a sanitary and environmental inspector, an admin, and and epidemiology and technology. And so those are all the things we're going to work towards in the next year to try to fill those needs through whatever resources that we can find to do that. We use contracted services for some of this. We are exploring any options for other staff. Our budget does not bring us, this budget also is important note, it doesn't bring us into compliance with these recommendations for public health excellence. It's just helping us move in that direction. And I know there's been some discussion about how does our work and Council on Aging, Youth and Family Services, police and fire, and schools, how do we intersect? And I just wanted to make clear that there's no overlaps. We just coordinate with each other and we collaborate with each other to ensure that we're providing the full scope of required and statutory things that we need to do. It's also important to note that we've really worked hard on any and every resource and opportunity for funding to support the health department. And really increasing our budget is the only way to move in that direction. We've hired 3 per diem nurses that are fully covered under CARES Act that really have supported our COVID investigations, our tracing, and any really other disease follow-up that's been needed. We've been awarded this Public Health Excellence Grant. That money is $300,000 for 3 years. However, it is shared between the 4 towns, and Northborough is the fiscal agent. So Southborough will not see any money from that. We will see service help. We will get support for some of the services, but there's an advisory that will oversee that, and that potentially will last for 3 years. It doesn't replace current activities, and it's only there to meet unmet needs. It also is going to give us up-to-date inspectional software, which is very expensive software that will help us going forward. So that is a really great benefits for food and housing code.
Mary Lou, can I just
Sure.
jump in for a second? So my understanding is it's $300 for the next 3 years, and that there's 3 possible renewal cycles for this. So it could be up to 12 years.
It could be.
Right now we're locked into 3, right?
We're not locked in yet. It was just awarded. Each town is going to look at what is that scope of services, and then they'll sign an agreement to be part of this shared services grant. And once you sign the agreement, you're agreeing to that period of time. And there is potential, there is talk that it will be renewal. I think there's a lot of unknowns, and any opportunity for other money to support the work we do, we're open to doing that.
Okay,
sure.
Thank you.
And then I'd like to thank Dr. Alker who has really worked hard to get other support. We've had interns and now have a resident that's going to be helping us. And those are all non-paid work, but require oversight and work from the health director in order to do that. And so that's one of the reasons why it's so critical to have core staff in order for us to do these other shared services grants, having interns, having residents. You need someone who's able to oversee that. So I'm really thankful that she's able to do that, and that's going to be a great benefit to the town. We're also part of a Metro West Foundation grant to help us with tobacco prevention and control, compliance, and education around smoking and vaping, primarily around our youth. We're exploring regionalization options. Those are always an opportunity that there'll a lot of work will have to go into that, but we're open to having those discussions. And we're currently planning on hiring 4 consultants to really support the work we do, but it's also going to benefit other departments in town. And that is a communications consultant, which we've just got approval that we can go ahead with that to move forward on that. We're still waiting for approval to hire a strategic planning consultant, which will help us identify the Board of Health current needs, gaps, and how to move us to probably a 5-year plan and getting us to where we believe that we need to be. We are also looking at hiring a privacy and security consultant to look at any HIPAA compliant audit and see where there may be any possible risks and how do we mitigate those. And then we need to hire a consultant to help us digitize our records. As you know, we have, I don't know how many file cabinets of paperwork that is, not searchable by easy means. And so we need to look at how do we digitize our records and index it in a way that we can search it and find it when residents need the information that we hold at the health department. So what do we do and what are we doing? What I tried to do is take some of our laws, our statutes, and our mandates and put it kind of in a user-friendly format. Hopefully it is. And so you can see how we're doing. Are we fully compliant? Meaning, are we doing everything that's required on that timeline of that mandate or statute? Are we partially compliant? Maybe we're doing the work, but we're not getting it done on time. Maybe we're doing it part way. So that's partially compliant. And then the other is non-compliant. We're just not able to meet those requirements. And some of the statutes and the regulations are kind of outdated. And so, or they don't pertain to us at this time. So I put non-current demands at this time, but staff must know about it. And as you'll see, as I'm going to go through them kind of quickly because people can view them on their own. But like an example of that would be dairy farm inspections. Well, we always did have dairy farms and we had to do those inspections. We have to look at milk production. We have to look at the safety of distributing the milk. We currently don't have any in town, but we could have one tomorrow. So we need to be up to date and know what we need to do about that. So in each of those areas on the scorecard, we put a green, a yellow, a red, or white, meaning that it's not pertinent at this time. I think the public generally knows that the health department is operated and managed by an elected Board of Health, and the Board of Health is a public safety agency responsible for many statutes, laws, both on the state, the federal, and the local level. We have local bylaws that sometimes are in addition to or complementary to some of the state and federal laws and regulations. Our goal is to prevent disease, to manage outbreaks, to promulgate and enforce regulations that improve the safety of our residents and provide health education to the public. Public health affects every resident in town. So our primary responsibility is really record keeping, ensure that we're HIPAA compliant, we're secure, and we have a searchable way to find things. So that's one of the reasons for hiring the consultant to help us digitize our paperwork. This is the laws and the statutes. As I said, I'm going to go through quickly, but you can go back and see these. And once I update the figures, we'll get this posted online so people can share it with anybody who wants to see that. So you can see we're compliant or partially compliant. or non-compliant, partially compliant and non-compliant on some of these things. Some of the other work that we do in sanitary and environmental health, we do septic inspections. Every home or business that's sold or bought in Southborough requires Board of Health intervention. We do food inspections, all food establishments. We have a little over 40 food establishments in town. They're supposed to be inspected twice a year. Currently, we don't have the time or the bandwidth to do that. So we need to get into compliance with that. We had a tattoo parlor and body art. We're required to license and oversee that the operations are being done safely, ensure massage facilities are licensed and operating safely. So here are the laws and the regulations. You can see we're partially compliant, excuse me, on some of these things, and some of them just don't pertain at this point in time. There's the milk pasteurization and eggs that I discussed earlier. The issues around plants, frozen desserts we had some in town, we don't currently. Food storage and refrigeration warehouses, we're not compliant with that at this time. We do septic, sewerage, and construction. And so I touched on that a little bit with Title V, affects every house and business that's sold or bought. Also new construction. And so when there's a large, building that's being built, a commercial building, we're involved in that and ensure that there's safe disposal of septic systems. So anytime there's new development in town, the Board of Health is involved in that. So these are our septic code regulations. We're either partially or fully compliant. I think we're doing okay in that area. We just need to do better at timelines and being able to cover what's needed 5 days a week. Safe housing, water, and air. We get involved with noise. We're currently involved in a noise issue that we have going on. Residents are entitled to have to live in an area where they're not impacted by unsafe noise levels. Water quality, we're involved in that. We have to inspect swimming pools to make sure there's water quality of kids or the public that swims. We have some public swimming pools that need to be inspected regularly, and air quality inspections that ensure the air that we breathe is safe. So these are some of the housing codes and the housing code regulations. Some of them were not compliant, some of them were partially compliant. Hazardous waste is another area where we are involved, the health department. We get involved in the proper disposal of hazardous waste. We need to ensure that there's safe trash removal, ensure proper disposal on land. We have issues of a landfill, or a couple of landfills in town that we've been involved with. We're now looking at licensing the trash haulers to try to get a better understanding of how much waste is being disposed, because our transfer station is looking at renewals. So, we need to work closely with DPW and other agencies in town to make sure that that happens safely. This is our solid waste regulations. You can see we're partially or not compliant for solid waste. Another big part of our job is emergency preparedness. We need to be prepared for disasters when they happen, whether it's a biological, a weather, or a man-made disaster. Those all impact us, and we're intimately involved in emergency preparedness, which is a lot of time, and we haven't had the time and the bandwidth to be as involved in our emergency preparedness work as we have in the past. And now with full-time staff, we hope that we will be able to be involved so that we can respond when these things happen. Prevention through policy. The health department has the ability to write and enact bylaws that improve the safety of our residents. We're involved in regulations, whether they're related to medical marijuana, to tobacco laws, to substance abuse and substance use disorders. We do everything from education programs to policies to bylaw changes. This is some of the regulations related to disease prevention and control. Disease monitoring, as everybody has identified, COVID has really shined a light on, disease monitoring that we do. And so with COVID, we've had to be intimately involved with very extensive COVID investigations and contact tracing to help us, decrease or prevent the spread of these communicable diseases. In Southborough, we've had 503 confirmed cases, and we've had 2 COVID deaths, although we think one of them is miscoded, and we're working on that. And that's how we work closely with the clerk's office, who looks at death certificates and the health department. And so we have to work closely with many departments in town. Also, it's important to note that it's not just COVID. I mean, this work that our public health nurse and the public health director, there's a typo in here too. The public health director have to be involved in this all year, with COVID, without COVID. And some of the other investigations we've done over the past year with COVID investigations are Salmonella, Campylobacter, Ebola travel monitoring, mumps, anaplasmosis, hepatitis C. These are just some of the examples of things that, when these things happen, the public doesn't necessarily know unless it concerns them. But by us being actively involved, we're able to prevent the spread to people unknowingly. And it's a very important role of the health department. I want to make note that the vaccine work that's been done has really been phenomenal. 71% of Southborough residents have received at least 1 dose. Yay, which is phenomenal. And some of that work is related to the work that we did with Ashland and Hopkinton at the Hopkinton Senior Center, providing vaccines to our first group, really our 75 and overs. And that was great. Dr. Heather was instrumental in working and helping with that. Doing Colonial Gardens, our own housing area. We did a Colonial Gardens vaccine clinic to help vaccinate the people that may not have the ability to get to one of these larger clinics. And now we're doing the Metro West Regional Collaborative Clinic in Westboro. That's operating weekly right now. It is hopefully going to be expanding to vaccinate kids 12 and up. I don't know, Heather, you want to speak to that? Is potentially, if all goes well today, will they do?
Right, 2 things. So we have coded for Southborough 3 COVID deaths, but I've reviewed it. Only 2 of them were were attributed to COVID, but 3 is on our books, just
Okay.
FYI.
Thank you.
And then in terms of the vaccination, the FDA has approved 12-year-olds to receive Pfizer, but the CDC is reviewing that today at noon. And when they also make a recommendation, the state will move to kind of make 12-year-olds eligible. We anticipate that will happen maybe tomorrow. We do have a clinic set up tomorrow afternoon for 12-year-olds, but if not, we have 4 afternoons next week set up for 12-year-olds. So it's coming. It's just the state has to sort of approve.
Great. That's great. And we know that, the work of vaccinations isn't going to end here. As many people know on the news and in the media, 12-year-olds will soon to be, and the hope is that vaccines will be approved for 6 and up prior to school year. So that will involve the health department. We're also talking about potential boosters where we need to monitor, whether someone had a Moderna or a Pfizer or a Johnson & Johnson vaccine and sort of triage that. So there's a lot of work that's going to go into that. And it may be annual vaccines is the recommendation going forward, which will involve our health department. So, a lot of work has to be done over the course of the next year and going forward related to this pandemic. We're going to be past COVID, crisis, but we're going to be dealing with COVID for a long time. So it's not when COVID is over, our health department will go back to normal. I don't see that happening. We don't see that happening as a board. We see our ongoing involvement with COVID related activities. We do work with smoking and tobacco. As I said, we're part of a collaborative of many towns that helps us with our compliance checks with smoking and tobacco use, primarily around youth. I think we're doing a fairly good job there. We could do better. Pandemics, which we just talked about. This is just a little, some of the other pandemics we've dealt with, none to the extent that we have in the past year with COVID-19. We inspect swimming pools, camps, and motels, which we have all of those. Public swimming pools need to be inspected. The camp, any recreational camp for youth needs extensive work, reviewing all the medicals, making sure that their camp is in compliance with the extensive camp regulations. So that is a lot of work, and we have quite a few camps in Southborough that have historically occurred. And so there's a lot of work that happens with the health department starting in the spring through the summer. Motel inspections also. These are the camps and the camp and pools regulations. Other work that we do is directly with the private and the public schools, with preschools and daycares. This is some of the miscellaneous other responsibilities that we have for animal inspectors, massage parlors, burials, and so forth. We can do better here too, and getting our staff up is really going to help us to meet some of these requirements. So how did we get here? I touched on this briefly. We, the Board of Health hired a full-time environmental agent 27 years ago, right, Paul? I think 27 years ago.
28, yeah,
28 years ago. And that was our most critical need at the time. I mean, doing environmental and sanitary inspections were what was what most of what the Board of Health did. After Paul's retirement, he worked part-time, and over that last 10 years is when a lot of the requirements, the regulations have expanded, but our staffing really has not. So the Board of Health really has not taken on the challenge to increase our budget to meet the needs as they've been going on. And I guess the pandemic is what sort of brought us to a reality that we need to get our Board of Health up to date. In 2019, Massachusetts provided that blueprint, and we would like to follow that blueprint and move towards full compliance. We did begin planning. For people to know, the Board of Health did start planning after that blueprint came out in 19. Or in early 20, we started planning for our strategic plan to bring us into excellence, and then we were hit by the pandemic. So, I mean, to some people, I think it was a surprise that, why are we just hearing about this? And honestly, this has been something we had been discussing, but everything got put on hold, just trying to manage the crisis that we had at hand. So that's kind of, I tried to get it done as quick as we can, and we'll post this. I'll update the numbers and we'll get it, I'll get it posted. But does anybody have any thoughts, additions, other comments?
No, I think you did a great job on that. Thank you so much for doing that.
One thing that I think is important to know about Southborough residents is 71%. That's also including people who aren't even eligible for the vaccine right now. So those 0 to 19-year-old group, we have 20%, which is amazing. And most of those people aren't eligible. So that's included in that 71%.
Okay, great. And I think we know that education is going to be key now, because we have some people that really are reluctant for a lot of reasons. It may be because they need more information, maybe they need more confidence. So some of our work going forward, Taylor, I think is going to be involved in helping people to better understand the vaccine and why it's important, and answer their questions to help them become more comfortable in getting the vaccine.
Absolutely. And we're already seeing that a little bit as well.
Chelsea, you had a question?
Yes. So and I'm just looking at your screen now. So can you just go to the miscellaneous slide right there? So I like the color here, because then you can just look at it quickly and see. I don't think you need all the columns. I think you can just consolidate to make one column and just make it red, yellow, or green.
Okay.
And then, because I think then you can just focus on like what the, it just takes some of the noise, I think, out of the slides. And if you want me to, I'm happy to go through and update those, because I think it's just formatting, and so I don't see that as an issue.
Yeah, that would be great. Okay.
Okay. So I'll wait until you update the numbers.
Okay.
And then I can go ahead and update that. But I think overall, this gives a lot of detail, if people are wanting to know exactly what we're doing and what we're not doing. In terms of town meeting, though, and having a handout, are you going to talk about that next?
I am, and that was my question, is what should we put in our handout for town meeting? My thinking is we just have really a one-sheeter, which is the budget. And then maybe a handout that includes this PowerPoint, which is the backup, as opposed to it all in one.
Could you have it
So-
on one side and have a two-sided paper?
So I think, this is my opinion, I think this is way too much detail for town meeting for people to pick up on their way in and then digest. What I would suggest doing is you can have the budget on one side, and then on the other side, I would make one table that has all the titles of your slides with the colors. And then you give an overall rating for that, and you can do a color, so like if we look at miscellaneous, I would probably give that a yellow, right? Overall, some you have green, some you have red. And then you have a risk column that calls out for that category what your highest risks are. So that way you can kind of just summarize and on, where we're in compliance, where we're not, where we have gaps. And then you just kind of do a summary as to, we're kind of navigating through this pandemic. We know that we have funding needs in next year's budget. And here's kind of a summary of where we're at. For more information, go view this meeting that you just presented the details.
So the only thought, the feedback I've got, Chelsea, is that when people are at town meeting and they're sitting there bored and there's discussions going on, they read materials. And so that was my only thinking I was thinking of putting this maybe 2 slides to a page, but simplifying it a little bit so that people could look through it. It's not, if the budget is a one-sheeter, like you said, that's a separate sheet. But if someone wants to get the detail while they're just sitting there, as we know,
So,
there's long
I
pauses.
would consolidate it then, if that's what you want to do. If you want to include, I think that the color slides here are important. I don't know that I would include all the pictures
Okay.
on there. I mean, I think it's nice for the presentation, but I don't know, that's my opinion. And then if you're going to do that, then I would definitely suggest doing the one column.
Yeah, because
you're
if we
planning on handing
did,
it out.
if we took all of the table of all of the regs and the statutes and put it could probably fit on 2 sides of a page. And then you consolidate the red, yellow, and greens into one column. It could probably be on one sheet.
Mhm. Yeah. I don't know that I would, I probably wouldn't do all these slides. I would probably just take
And put it in a long
Data.
table.
Yeah.
Nancy or Heather, do you have any other thoughts on that?
I don't mind it the way it is, quite honestly. I'm always looking for stuff to read at town meeting because I do get very bored. I hate to admit it, but I do. And I don't know, but this isn't really my milieu, so maybe I'm not the one to chirp in, but I kind of like the way it looks.
Okay. Well, I'll work on, and Chelsea and anybody else who wants to weigh in, and we'll figure out something. We have to have it to the clerk's office by Friday. So we need to get that, get it finalized. But I think, is there any information that's not included or information that's here that you don't think should be included?
I think I like all the information that's there, and I think it should be included.
The only thing I would add, I think, is make it clear that that you were ready, we as a town were ready to receive vaccination when the state released it. And that it wasn't, we had no control over when that was going to be released. So I think, at least that's what I'm hearing is, that the vaccination clinic in Westboro is fabulous. Wish we had gotten it earlier. And I was like, yeah, but it was really the state that was, we were waiting on the state to release it. So I think if you can add that in somewhere, Mary Lou, I think that's an important point, that we did collaborate with other towns. We tried to join forces and maybe even list out more detailed what departments from Southborough are invested in that. Like I know the fire department, CERT, MRC, coming together.
Okay. Yeah, we can do that.
Okay.
Okay. Any other thoughts or comments before we adjourn?
No.
I can stop screen sharing.
So are you, Tim Let just wrote in the chat that columns are not accessible. So I'm assuming that whatever gets printed at town meetings in black and white. Okay. So that won't work.
I was told I can do color, but
Oh, okay.
we'll see.
I
We'll
like the color actually. So
we'll
that
figure that out.
Okay. So are we going to meet next week to talk about who's going to present at town meeting, or are you going to do that now, Mary Lou?
I don't. Do we have any other, Heather? Do we have anything on the agenda or in the next? So town meeting is on the 22nd. So that's a week from this Saturday. So do we have anything that we need to meet on besides talking about town meeting?
We want to write our letter to ZBA for next week, but we already voted to do that.
Right. Okay.
Um,
I don't think so, right? We don't have anything urgent. So I guess talking about it now makes sense. So the budget will be presented as what's in the warrant. And so then there will be a hold on that. So what are your thoughts, Chelsea?
So I think we can, I certainly think we can hold our own budget and then present the modifications to that budget and why we're changing it. And then I think it makes sense for the same, like Kathy said, for the same person to do the reserve fund, because if you transfer it out of Board of Health, it should go into reserve fund, right? And then the assessors increase to Barbara's time to match. So I think that, I mean, I'm happy to do it if you want me to.
I think
That's
that
fine.
you know the process and the protocols, like more of how the process works. So if you want to do that, and
Okay.
then if you want me to comment and speak to the issues, I'm
Okay,
more than happy to do that. And
Okay.
that's probably more appropriate.
yeah, that's fine.
Okay.
Let's plan on that then.
Okay.
So I mean, I'm just gonna purely go off of the numbers.
Right.
And I'm, just the reasons why we changed it. And I think I'm pretty clear on that. And then what will probably happen is that you should then come up and then talk about, what we're expecting in the next year, and that FY23 would be a different look than what we're seeing for FY22.
Right.
And then field any questions.
Okay.
Okay.
Yep. Sounds like a plan. Anything else?
I don't think so.
Okay. Thank you, guys. This was a productive meeting.
All right.
And thank you. Have a good day. Meeting is adjourned.
Thank you, Mary.
Thank
hold on, you gotta do a
you.
motion. You gotta do a motion, right?
Take a motion to adjourn the meeting.
Yep, second.
Okay. The meeting is adjourned.
No, you gotta take a roll call.
Oh, thanks.
Yeah, and I think we already lost
Oh, Nancy.
Nancy, so
right.
Malinowski, aye.
Mary Lou, I.
Chelsea's going to be a parliamentarian, which is great.
All right, thank you.
All the rules better. All right. Thank
Bye.
you. Bye-bye.
Okay.